Welcome. This module has been designed to raise your awareness of the risks associated with heat-related illness. In a hot environment, the human body maintains a normal body temperature of 37 degrees Celsius by removing excess heat. This is done by increasing blood flow to the skin, exhaling excessive heat through breathing, and by sweating. When working on a boat, you might experience a variety of heat-associated hazards. These include working on the deck in hot weather or when humidity is high, working near machinery, exhausts, or other sources of radiant heat, prolonged strenuous activity, and wearing bulky or heavy clothing and personal protective equipment for long periods. The main types of heat-related illnesses are heat rash, heat cramps, heat exhaustion, and heat stroke. Managing these illnesses can be challenging when working on a boat, particularly during busy work periods. However, it is important they are managed carefully, particularly heat exhaustion and heat stroke, the latter which can be fatal. Heat rash is typically a minor skin ailment that should disappear without treatment in 3 to 4 days. Keeping the skin cool can help minimize the rash, and creams and ointments are available for heat rash if necessary. Heat cramps can be very painful and temporarily impact your ability to work, particularly if the cramp is in the calves or thighs. The pain should quickly subside or disappear. Rest, massage, and drinking fluids is the recommended treatment. Heat exhaustion is caused by excessive loss of fluid from the body. Obvious signs and symptoms of heat exhaustion include profuse sweating, headache, nausea, and vomiting. Additional signs include feeling tired or weak, cold, clammy, and pale skin, a pulse that is rapid and weak, rapid breathing, and very dark-colored urine. A person with heat exhaustion must stop work, move to a cool environment, remove excess clothing, and rehydrate with water or electrolyte sports drinks. Fanning air over the face and moistening the skin with a moist cloth is also important. If a person with heat exhaustion is not treated, they may suffer from heat stroke. This occurs when the body can no longer control its temperature, which rises to 40 degrees Celsius or more. A person with heat stroke may no longer sweat, their skin may become flushed, hot, and dry, and they may hyperventilate, become faint, confused, or fall into a coma. A person with heat stroke must be moved into a cool environment, removing unnecessary clothing, applying ice packs to neck, groin, and armpits, and fanning the body. Sips of cool water can also be given. It is essential that medical attention is sought immediately due to a risk of coma, organ failure, or worse. Recalling the hierarchy of controls, a variety of engineering controls can be implemented by the boat owner or skipper to reduce heat in the workplace. These include air conditioning, fans, heat shields, the use of mechanical equipment to reduce physical job demands, and the provision of shade in outdoor areas. And administrative controls can also be applied by the boat owner or skipper, including a requirement for regular rest breaks, scheduling physical tasks for cooler parts of the day, rotating heavy tasks between crew, providing adequate drinking water, allowing crew sufficient time to acclimatize and allowing work at a slower rate, and provision of heat-related illness training in the workplace. While a combination of engineering and administrative controls can reduce the prevalence of heat-related illness in the workplace, you must also take responsibility when working in a hot and physically demanding environment by drinking plenty of water, working within personal physical limits, and monitoring yourself and others for signs of heat-related illnesses. Excellent! You have completed the heat-related illness awareness module, so let's review the material that we covered.